The concept of work requirements in Medicaid went back to court, this time a federal appellate court. We're talking about two different states here, both with similar issues. Arkansas and Kentucky both had implemented work requirements in their Medicaid program. Both had received federal approval to do so, but it was taken to court by plaintiffs saying that this was not advancing the health of their state or advancing the Medicaid program objectives. Federal court agreed with them. It then went back for the state to redraft a waiver, went back to CMS, the Centers for Medicare and Medicaid Services, who reapproved the waiver, and then the judge in federal court blocked it again. Fast forward to moving to the federal appellate court, and that's where we are now. This federal appellate court had a 3-judge panel that listened to the arguments in both Kentucky and Arkansas to determine if work requirements in the Medicaid program would advance the objectives of the Medicaid program and would help with the health of the people of the state. The argument went quite well from the perspective of the plaintiffs, arguing we should get rid of these work requirements. You don't work to get healthy. You get healthy with the support of Medicaid in your state to then be able to work. We will be waiting for the weeks ahead for a final decision to come out of those courts. In the meantime, there has been some new data from 2 different sources talking about work requirements in different ways. The first comes out of the New England Journal of Medicine. There was a new study of the first year of work requirements in Arkansas itself that says, implementing work requirements in Arkansas for that first year didn't really have a significant impact on the rate of employment, even though that was the biggest argument coming out of the state of why they wanted to implement work requirements in Medicaid. The study actually went on to say, in fact, 20,000 people in Arkansas lost coverage in the first months of the requirement despite working. They were working. They lost coverage because they had trouble reporting that work. So most adults enrolled in Medicaid, although a lot of them are already working, were still losing coverage. So this new England Journal of Medicine's report came out very timely as the issue was being litigated about that state itself. Also coming out in the last week is a report from the Government Accountability Office, the GAO report, that says there is huge administrative cost to running a work requirement program side by side with your Medicaid program. The quote coming out of that report is that we found that cost to administer work requirements may range from millions to hundreds of millions of dollars per state. Now, CMS, the Centers for Medicare and Medicaid Services, does not consider administrative costs when they're actually approving whether or not a state can implement work requirements. The work requirement feature in a state Medicaid program is supposed to be quite neutral. And the states that are getting waivers approved are saying, yeah, our costs are quite neutral for this, but they never take administrative costs into effect. And the GAO report just issued says, actually, that could be hundreds of millions of dollars of administrative costs, not making it worthwhile if you pair that with that New England Journal of Medicine study that says, and it's not even helping more people find work. So there's a lot of news coming about work requirements, that appellate court, the oral arguments, the New England Journal of Medicine, the Government Accountability Report. You can read these in the description below. We provide some links. As we await that work requirement decision from that appellate court, we will come back to you with updates. So make sure you hit the like button and subscribe so you can get those updates.